The Lifetime Achievement Award recognizes the commitment of medical professionals who dedicate their lives to health equity and to improving access to care for all our neighbors in need. This year's honoree, Dr. Mayman Thint, was a dedicated primary care physician with Ascension St. Vincent's Healthcare. She was also a tireless community health volunteer. Though we lost her to ovarian cancer during the global pandemic, her legacy lives on in the work of free and charitable clinics she helped make possible. From her service as medical director for the Legacy of Care Clinic to establishing a new community health project with the Myanmar Association, she served the needs of her patients with a heart for compassionate care.
Dr. Thint has served at St. Vincent Healthcare System, and she was our primary care physician for over 2 decades, I believe. And she was well loved. There's a Dr. Thint's Community Center at St. Vincent. If you go and visit St. Vincent, you will see her name on one of the community building after her. That's how her effort, her dedication has been recognized and awarded. She cared, she invested her time, and her clinic is always overbooked. And she skipped her lunch seeing the patient in between the appointments. That's how her dedication towards the patient's care. And then even then with a busy schedule, she always makes her time to have this community service on weekends. Myanmar is a little unknown country in Southeast Asia in between India and China. We have estimated about 10,000 have most people are running away from home because of fear of their lives and the oppression. And they just restarting their new life here. We are become a part of the larger community, and we be proud to serve in our new home here. Yeah, I met Mimon. We just sit, because of the close community, we sit, chit-chat, talk about it, and we just get brainstorm together to had a set up 2-3 clinics a year. That was our projection. And now being a popular demand, so it's began catching the momentum. So we moved to a monthly clinic from that point onwards. Dr. Thint vision is to have a better care for the underserved population, and she is the eye-opener of the community. She introduced us to this WeCare, and she had mission, make sure, when she called me make sure go there, just respond this email, fill this form. She's like coaching me every single step all the way until we get connected to WeCare. And now we have getting the fruits of what she had, effort. We are proud to be a part of the WeCare, and it's as a result of her diligence, her dedication, and her commitment, and her persuasiveness. Dr. Thint is very special, in our mind, in our heart. I feel like that's what the legacy lives on. Her mission is a community service, and she cares so much about patients, even to the last minute of her sickness. And she also keep writing her emails to our chronic care patients to make sure they fill the scripts, make sure they had the sign up for their primary care doctor, and saying the goodbye notes for every single patient. And she's such a character woman, and we will never forget what she done for the community, and we will ever honor her service and the legacy.
The Sister DeSales Award for Outstanding Administrator recognizes that practice leadership and commitment to the business of medicine starts with patient-centered care. From her role as an operating room nurse to her time in helping create the administrative backbone of WeCareJax, her life remains an inspiration for all who help make compassionate care possible.
Sister DeSales was a force of nature. She was an advocate for those who couldn't speak for themselves, whether it was children, whether it was those that were below the poverty level, whether it was someone that was under anesthesia. Sister was about for those who couldn't speak for themselves. Sister was in Jacksonville and serving at St. Vincent's in a number of capacities. She was an operating nurse. Before that, she was a school teacher. So Sister had a lot of chores in her life. She was already the director of mission services at St. Vincent's and very much involved with operations and nursing and the infrastructure and administration of St. Vincent's. And at that very same time, WeCare became a concept. And it was for those that couldn't afford any medical care. So she worked with Dr. Trotter to set up clinics. The problem with that was that there was no funding for these clinics. She came to me and she said, I need your help. We have no way of getting any pharmaceuticals for these patients that are visiting our clinics. And could you see what you could do with the Riverside Hospital Foundation to facilitate these dollars? And so in 1995, I helped her get $35,000, which was the first grant that the Riverside Hospital received.
She was a great mentor. I kind of looked at her as, for those who know the Bible, Ruth and Naomi. She was my Naomi. And she just kind of took me under her wings and taught me so much. One of the things that Sister always said, it shouldn't be so hard working with the poor. Why is it so hard working with the poor? She was an avid fundraiser. Many times she would send me to pick up checks, and she says, don't come back without it. You know, it was like she had already called them and told them what they needed to do, and you just walk in there and pick up the check. And if you have any problems, call me.
One of the things I learned from Sister, and that's probably been the most difficult thing for me to live up to, is that when we do any charitable work, it's very important to not do it at the price of the recipient's self-respect. So that those that are receiving this award, I would think, are very special in the fact that they gave of their time and of their talents and respected the individuals that were receiving the services. It's a tribute to Sister's desire to make sure that all among us could have the health care that's available.
The Freddie Webster Award for Nursing Excellence recognizes outstanding commitment to compassionate care and service to those neighbors who need it most.
My name is Freddie Webster, and I'm a registered nurse, and I have been for over 50 years. In 2001, there was an ad in the paper, and I applied for the job, and I was interviewed by Sister DeSales and the Department of Health nursing manager. And they gave me my responsibilities and my expectations, and they hired me right on the spot. When I walked in, I was the only employee. And so I walked into an office with file cabinets and a key. I came from a clinical setting, so to come into a nonprofit, I had a lot to learn. To see WeCare grow and thrive was an exhilarating experience. I saw the organization grow with the funding, with the staff, office space. I was just so grateful. I worked approximately 18 years and I retired and I began to work part-time up until last year. And I really enjoyed my work and I enjoyed my job. And I really didn't want to leave then, but I was grateful to just be a part of WeCare and the history of WeCare. My motto for WeCare is, all of us are one heartbeat from being uninsured. So our services can be from almost anyone, especially because most people's insurance is tied to their jobs. And once you lose your job, you lose your health care. So we're all one heartbeat away from being uninsured. To have an award in your name is, to me, humbling. And I just, still hard to imagine that I have an award in my name. The award was for compassionate care. And I like to see that as my main characteristic. I'm a nurse of compassion. I care about my patients. And part of that is kindness, gentleness, integrity, honesty. All of these are my core values. I want the people who receive this award to know that WeCare is a necessity to the community. There's no one else that does what WeCare does. So when they come, they should come with a heart of humility because of who we serve. And I want them to know that they should be going in for the long run and that the patients should be their center of focus.
The Dr. George Trotter Founders Award for Physician Service recognizes the earliest days of compassionate care for our uninsured neighbors in Duval County. Nearly 30 years ago, Dr. Trotter was approached by former Jacksonville Mayor Tommy Hazouri and local leaders I.M. Sulzbacher and Monsignor Mortimer Danaher to help develop a plan for our community's uninsured adults. That includes those without permanent housing or shelter. Working with his colleagues in the Duval County Medical Society, Dr. Trotter engaged the very first physicians to offer uncompensated care to the community.
I think WeCare has gone beyond my scope. I'm not so proud as much as I'm in awe. I thought one way we could also get some money. I got the idea of the Physicians Variety Show. The first name of it was Doctors After Dark. We had a great variety of talent, and not to toot my own horn here, but I did a pas de deux. To me, it has never been work. It's been fun.
Though Dr. Trotter made every minute fun, his service came from a place of deep understanding about the nature of healing and community care.
Doctors are blessed to be able to be a doctor, because I say that every morning, most mornings, that, if a doctor, I think, has someone trust their life to a doctor, how important is that? How incredible is that to know people come to you when they're sick? You gotta feel it.
This award recognizes the ongoing spirit of service Dr. Trotter envisioned in those early days of WeCareJax. Dedication, humility, responsibility, trust, and service. Physician volunteers are the heart of WeCareJax, and this award recognizes those who have gone above and beyond to make compassionate care possible. If we have learned anything in the past several months, it's that despite all our masking, avoiding our favorite places, and social distancing from the people we love, we still need each other. We have learned how vital our friendships and relationships are, and how much we all need compassion and care. Care is what we are all about. It is right in our name. And at WeCareJax, we deliver on our name every day. While the pandemic first sent our staff home in March of 2020, we never wavered on managing and referring our patients for critical specialty care. Thanks to our dedicated physicians, clinics, and hospital partners, we continue to ensure our patients were treated compassionately and professionally. The pandemic didn't care that our neighbors needed vital life-saving services, but we cared. That's why last year, the volume of care secured actually increased. We scheduled more than 4,000 appointments for over 1,600 unique uninsured patients facing a medical crisis. Because heart attacks, broken bones, and even cancer didn't stop just because there was a pandemic. And while our patients were experiencing not only a personal medical crisis, but also the instability the pandemic brought with it, including losing jobs, losing housing, even losing loved ones to COVID-19. WeCareJax held virtual hands, providing needed reassurance and an empathetic ear, making sure none of our patients fell through the cracks. Even amid the worst of the pandemic, we cut down on the time elapsed for scheduling, managing to secure appointments for 59% of our patients within 1 week of the request for care, and 89% were scheduled in less than 60 days. That's actually higher than our annual benchmark of 80% when there's not a national crisis. None of this could have happened if it wasn't for our physician volunteers and for you. In fact, every dollar donated to WeCareJax turned into $25.17 of donated medical care, treatment, and support for our uninsured neighbors in Duval County, at no cost to the patient or their families.
One of the things that we can be proud of is that we were able to innovate, to change the way we do business, to change the way we provide care to patients, telemedicine visits, Zoom calls in order to coordinate meetings and efforts, and it just truly shows that things work better when there is a group of people that are committed to a dynamic and wonderful cause like ours. And I'm so grateful that we were able to make those changes so that we could keep our doors open for our patients.
Innovations truly powered the last year, and finding new ways to support our neighbors in need with other organizations doing great work helped all of us meet new challenges, like fresh, low-touch produce deliveries for cancer patients in active treatment from local farmers with full fields but nowhere to sell their products.
We are grateful for WeCare, for the work that they do, to be able to partner with WeCare and organizations like WeCare to really bring our produce that has low touch, no pesticides, no herbicides on our products, to be able to bring them right to the families, because food is medicine.
Like the physician leaders of the Duval County Medical Society, who launched WeCareJax with local media to ensure our community didn't lose sight of another virus that could weaken us while we focused on COVID. Like the nonprofits who joined together to secure emergency hotel rooms for our neighbors without addresses to recover after they learned they had COVID. And those online consultations that kept patients safely at home while connecting to their care team to hear lab results and review treatment plans. Neighbors helping neighbors. That's what WeCareJax is all about. To our volunteer physicians and providers who are the heroes of the last year, to our hospital and clinic partners, to the nonprofits shifting to new ways of helping, and to all the donors who make this work possible, you have our heartfelt gratitude for being there for this once-in-a-100-year challenge. Instead of keeping your distance, you stepped forward, embracing the mission, helping us continue to make compassionate care possible. You care, and we care. Together, we will work hand in hand for a brighter, healthier future.
During the course of the COVID pandemic, one of the things that we can all say, one common word, would be that we all faced a lot of uncertainty because these are unprecedented times. And what I think is really important is that the bright spot is showing that when people work together, no matter what the circumstances are, great things can happen. We can persevere, and we can continue to show love and dedication to our entire community, and particularly in our case, for those patients who are in need. So that is just a shining beacon of hope and promise for all of us. And thank you so much for working together to show that we care.